Hello everyone, and welcome to the 2021 Holland Hospital Men's Health event. We're so glad you're here, and we can't wait to get into all the important topics and information we have in store for you.
We're all here for one very important reason: to learn more about how we can sustain healthy lifestyles in order to live the best and longest lives possible. And this year, when we talk about health, we're talking about more than just physical fitness. We're also focusing on mental fitness and everything that comes with it.
The last 2 years were very different than any others. We collectively faced something we've never seen before, and it affected us all differently. Some of us may have struggled physically, some mentally, or maybe even a little of both. But no matter how much we struggle, there are ways to get back up and keep moving forward.
This year, we're talking about balance. From balancing work and life, to mental and physical health, to checkups and supplements, to cheat meals, and more. You'll hear from Holland Hospital doctors on how to manage these things in a way that brings balance to your brain and your body. So without further ado, gentlemen, let's talk about our first topic, mental fitness. Take it away, Dr. Dumaroff.
Hi, I'm Dr. James Dumaroff. I'm a psychiatrist at Holland Hospital and medical director of behavioral health services. Mental health concerns, for men in particular, have at times been viewed as a sign of weakness, and that's a cultural issue. It's a historical and societal issue, and fortunately it's changing. Men are becoming more open in understanding that their mental health is part of their overall health, and as more people get treatment and talk about their treatment, it's giving men more permission to seek help with depression and anxiety or stress or other things that they're dealing with. It's helpful to understand that where people are at in life impacts what's going on with their mental health. When we're young, we're still trying to establish identity. And so for a lot of younger people and young adults, trying to figure out who they are, what kind of life they want to build, what kind of relationships they want to have, can be really a struggle. People are inundated with social media telling them who they're supposed to be, and that itself can create a lot of stress and anxiety. And so those identity issues that young people struggle with and that can contribute to anxiety and depression can be really, really helpfully addressed working with a therapist. When men hit middle age, they're struggling with other challenges, trying to figure out if they're on the right path with whatever their career is, dealing with perhaps aging parents and young children and those dual responsibilities, and trying to, if they're in a relationship, make sure that they're putting appropriate energy and focus into maintaining a healthy relationship. And those multiple demands can pile up and create stress and anxiety. And if that becomes overwhelming, then meeting with a therapist for even a few sessions can really be very clarifying for people. And then older adults are often struggling with, what's my purpose? Men and women often define so much of their identity around their career. And when people retire, they're really needing to move into a new identity, and it can be a struggle for people. And so again, having a place to go and explore, I want to be purposeful, I want to still have significant meaning and feel like I make an impact in the world, and exploring that with a therapist can also be a really healthy thing to do. One of the things one should consider is if there's a change in motivation, if there's a drop in drive to get things done, a lack of motivation sometimes can be a result of a clinical issue like depression. People who are depressed lose a lot of energy and a lot of drive. Sometimes it can be an issue of people being on the wrong path in terms of what they're leaning into in terms of career or education or relationship. If somebody who's close to you is expressing concern or suggesting that you should consider getting help, take that very, very seriously. If whatever you're struggling with, whether it's depression or anxiety or trouble managing stress, if over a little bit of time it is really getting in the way of you being able to function, either at work or at home or in your relationships, or if it's causing a lot of distress. I haven't had a good day in I can't remember how many days or how many weeks. At that point, it's time to think about getting help. And that help could start with a conversation with your family doctor. Primary care doctors these days are well trained in dealing with mental health concerns. They're very aware that it's a big part of their practice. There's a lot of other resources in the community as well, including our practice. And talk to somebody in a medical profession and get the help that you need. It's readily available.
Hi, my name is Matt Hilton. I'm a family medicine physician with Holland Hospital, Family Medicine Zealand, and Holland Hospital Sports Medicine. When it comes to sports and activity, preparation is really important. You need to know what you're doing, what it entails, what kind of skills you might need, and how vigorous or mild the activity might be. But you don't need to be doing a ton of running if you're preparing for something that doesn't require a lot of cardiovascular fitness. On the flip side, you don't need to be bulking up with your strength training if you need to be doing something that requires endurance training. You need to be focusing on the specific skill set that's going to require to the activity you're doing, and go from there. You're not going to go out and run for 2 hours right off the bat if you've just been sitting on the couch all winter. That's a bad idea. It's a great way to end up in my office talking about your injuries. And I'm happy to see you for it, but I'd prefer not to. Pre-workout stretching is something that you will get a lot of different answers to. Some people are huge advocates of it. Other people poo-poo it as nonsense. And the evidence is pretty mixed on it, and it has not really come down with a solid, yes, you should do stretching. What's been shown to be more beneficial is simply warming up. Getting the heart rate going with some kind of light activity, getting your heart rate above your normal resting heart rate to get the blood flowing to all your muscles and joints. Stretching cold muscles is not really a great idea, nor is it that effective. So simply warming up is the most important thing. I'm a bigger advocate of stretching after activity because the muscles are really warmed up, your heart rate is going, and it's a great way to cool down and reduce some of the post-workout soreness that you'd experience if you didn't stretch. I think it's most important to have the appropriate fuel for your activity and the appropriate fuel for your body. So if you're going to do something light, you don't need a lot of calories to get ready for that. If you're going on a long endurance activity, you're going to need a substantial amount of calories for that, but it needs to come in the right form and in a digestible fashion so that you're not getting halfway into your activity and puking on the side of the road. I think performing without hydration is maybe even a bigger risk. So making sure you have plenty of hydration, starting with the night before if you're doing something really, really strenuous or active, or if it's really hot out. If you're not drinking until the day of or the morning of your event, you're getting behind already, especially if we're talking about hot months where potential cramping is at play. At least an hour before your activity, getting approximately 16 to 20 ounces of water is really, really important. Rarely do we need Gatorade or Powerade or something like that because we usually don't sweat enough with typical run-of-the-mill activity to need something like that to replace electrolytes. If you are out on a long endurance run or ride or something that requires a lot of activity, certainly something that has some sugar in it would be totally reasonable and actually beneficial for your activity so you're not bonking. I would certainly try and steer away from energy drinks in this situation because you may not understand how your body responds to the caffeine. Most of them are carbonated, which is not great for activity. It's not going to feel good to you. And there's usually lots of other supplements that are in there that you may not know how you respond to them. So I'd stay with your traditional sports drinks if you do need them. I love coffee. And I think it's a great stimulant to use with sports and activities if it's done appropriately and you know how your body responds. I would never advocate for going to a race or a competition having never used caffeine with athletics and try it for the first time. In preparing for your activity, you're also going to want to make sure that you're well rested. The general rule of thumb of 7 to 9 hours of sleep is still good for activity, just like it is for day-to-day life. It can be hard to sleep before the night of a race or the night before a game because you got those jitters going, but do your best to maintain a sleep schedule and get good sleep, not only for preparation, but also recovery from what you did the day before. Sleep is important because it helps rebuild muscles, and you want to maximize the gains that you put in the gym, out on the field, or out on the road that day, and not just leave that to waste.
My name is Joel Veldhuis. I am an internal medicine and pediatric doctor at Holland Hospital. The core of men's nutrition is being a healthy weight, and so any diet that has the same amount of calories in as calories are being outputted and energy output each day is what I aim for as a baseline for most of my patients. The way I see it as a doctor is that many men who have unhealthy weights come to me with their complaints. And their complaints are sleep, fatigue, and pain. And people don't really think about pain a lot when they think about being a healthy weight, but I see a lot of people who come to me in their 40s and they already have destructive joint disease, end-stage joint disease, from being only 40 or 50 pounds overweight for 2 decades. It doesn't really take that much to harm a human joint, and so the benefits of staying a healthy weight are actually avoiding those problems. I have tons of men who talk to me about their lunch break. They're given a lunch break. They're supposed to take a lunch break. I would like people to bring their lunch to work and go for a walk. I've had lots of people lose weight just by cutting out the 1,000 calories that they were eating at Culver's or whatever else. Lunch, basically, also I recommend that people eat a fruit at lunch and then they have a small entree. Today I had a leftover hot dog and 6 peppers that were cut up. I threw some barbecue sauce on, and that's what I ate. And then I ate an apple along with that. And for breakfast, I just tell people you should always just be eating a fruit for breakfast, an apple, a banana. Breakfast should really be nothing more than fruit, in my opinion. So I know that's the age-old thing, eat an apple a day, keeps the doctor away. In my opinion, apples are great. I rarely get sick of them. They provide good fiber for my diet, and they can fill you up pretty quickly. They're easy to bring along. So a lot of the avoiding bad food is really just having mobile food, and the most mobile food that there is out there is fruit. In general, I don't recommend high protein diets for men. There may be the random bodybuilder who needs a high protein diet in order to build that much body mass. If bodybuilding is a career for you, then you'll probably need a high protein diet. For everyone else, I don't recommend high protein diets. High protein diets can be associated with kidney problems in the long run. And in general today, what we're talking about is actually reducing your calories, right? So when you're eating a high protein diet, you're basically eating a high calorie diet. None of us really need that much protein in order to gain muscle mass. You can gain muscle mass by eating fruits and vegetables and working out. So I don't recommend the high protein to do that because it is associated with some kidney issues. My number one piece of nutritional advice for men who need to lose weight is to download the MyFitnessPal app. Don't change a thing about your diet for 2 weeks. Calculate all the calories that you eat over the next 2 weeks. And then ask MyFitnessPal if that's too much or too little. And it generally will be too much, and you need to cut back on calories, and that's the number one way for you to lose weight and get back into a healthy weight. For those of us who are a healthy weight already, I recommend a 20-minute core and strength routine that you can do 3 times a week at home. And for both groups, I recommend hanging out with kids as much as possible. Whatever kids are in your life, I really highly recommend hanging out with kids. They're great for mood. People ask me what the fountain of youth is, I say the youth. The youth are the fountain of youth. And they really do keep a lot of my patients much more active and healthy. My kids keep me active and healthy, and I think people kind of underutilize them. They don't play with their kids. They don't enjoy the activities their kids enjoy, and I think people need to do more of that. For me, no one is ever going to eat perfectly healthy all the time. There's just too much junk out there. There's too much good stuff. For people who are healthy weight, who are active, I like to tell them to plan your indulgences, know that you're going to indulge in some things, and enjoy it.
Hi, I'm Dr. Dan Maring. I work as a primary care physician at Family Medicine Zealand for Holland Hospital, and I'm here to talk to you today about staying healthy, nutrition, and how primary care can help you do that. Most people, men included, will need to access the healthcare system at some point in their lives, and this increases in probability as we get older. The first point of contact is often a PCP or places like an ER and urgent care. However, PCPs can often address acute concerns, thus saving a trip to an ER or an urgent care, and having a PCP can help you determine whether or not you need a higher level of care for a concern, rather than going there and maybe not needing it. A primary goal of primary care is to have a relationship with the patient and to build trust and rapport. And when we make recommendations about health screenings or medications or nutrition, all that is done within the context of the whole person, taking into account their background and their preferences and their goals to stay healthy. A recent study came out about the importance of primary care and showed a statistically significant decrease in mortality for those people who had greater continuity with a primary care physician. So at a typical annual physical, your health history is updated. We note any changes to your family history. We gather information that might help determine your risk of certain infections or other diseases. A physical exam is typically performed, focusing on each body system. And then this is followed by education on ways to stay healthy, age-appropriate screenings for things like cancer, diabetes, hypertension, certain infections, and then kind of age-appropriate education about preventing falls or proper nutrition, things like that. We also ask about things that lifestyle factors that might positively impact your health, and then we also might talk about things that might negatively impact your health, things like smoking or diet or lack of exercise, and address those things. So I think for most people, a whole food, plant-based diet is ideal. Generally, people are recommending a Mediterranean-style diet for the prevention of heart disease. And this diet focuses on whole plants, fibrous vegetables, and healthy fats like foods that are rich in omega-3 fatty acids, so oily fish and nuts and legumes. That seems to be a diet that leads to better outcomes. And then avoiding processed foods and large amounts of saturated fats. You know, this might be an overgeneralization, but I think men typically will go long periods of time, especially in their young adult years, where they feel well, they're early in their professional careers, or they're working lots, they have young families to take care of, and they don't find the time to get established with a primary care physician. And I would encourage that group of men to just get established and have somebody that they can turn to for questions, or if something comes up, and to be seen every couple of years. And I think building that relationship over a long period of time, especially when you're young, can really have tremendous impacts for their health as they get older. I think prevention is really key to long-term health, and so young men who typically don't go to the doctor should get in, even if they feel well, even if they're healthy. I think it's important to have somebody to partner with to keep them that way.
Hi, I'm Dr. Erickson Adams. I work at Family Medicine South Washington, and I specialize in family medicine, sports medicine, and lifestyle medicine. Today we're going to talk about physical health. Physical activity is so important. If it were in a pill form, we would all be taking it, and we'd be spending a lot of money to take that pill. It helps with our mood, it helps decrease symptoms of depression and anxiety. It helps with our cognitive function, our thinking. It decreases our chances of dementia. It can decrease our chance of having heart problems in the future as far as heart attacks. It can decrease our chance of having strokes in the future. As far as particular to men, it increases testosterone. It's one of the best ways naturally that we can increase testosterone. It decreases the chances of erectile dysfunction. It increases our cardiovascular fitness, so we're able to keep up and do everyday life things better, like play with our kids and our grandkids and things like that. There has been research done to back up these numbers, and it's recommended that 150 minutes per week of moderate intensity exercise or 75 minutes per week of vigorous or high intensity exercise. If you're looking at 5 days a week, 30 minutes, 5 days a week is the goal. If you're someone who wants to do the bare minimum, even just 15 minutes a day, you can increase your life expectancy by 3 years just by exercising for 15 minutes a day. In addition to that, so that's kind of the cardiovascular part of exercise. And in addition to that, an extra 2 sessions per week of some sort of resistance training. So for some people, that can be weight training with weights. It can be body weight training, such as squats, push-ups, those types of things. And without any weight, it can be things like yoga, Pilates. Those are all good ways to increase your resistance and your strength. If I sit here and tell you, you really need to run 5 days a week to get in shape, and you hate running, you're not gonna do it. So I always ask patients, what did you like doing as a kid, or what were you involved with in high school? Did you play basketball? Were you playing baseball? Were you in the cross country team? You just have to think about things that you enjoy that can kind of fit into your mold of physical activity. If you are someone who is relatively sedentary, kind of a couch potato type guy, and you're just wanting to increase your health in general, doing a half-hour walk every day of the week or 5 days a week is great. If you do that for a whole year and all you're doing is walking and you don't modify it at all, that's a great improvement for your health. If you're someone who's looking more to tone up, to get more buff, to be more physically active, play with your kids, grandkids, basketball, that kind of thing, then you are going to want to vary your routine. So maybe do strength training one day, more interval training another day, cardio training one day. That's going to be the best to kind of keep your muscles confused and help to build up that bulk and the muscle and the tone that you're looking for. So avoiding injuries, you can think of it as doing things within your exercise that help to decrease your chance of injury, and doing things outside of your exercise to decrease your chance of injury. So during exercise, making sure you give yourself a little bit of time to warm up. It doesn't have to be anything crazy, but have it be something within the type of exercise you plan on doing. So for instance, if you're gonna be running, do some quick walking for your warm up. If you're gonna be swimming, we probably all have this visual of Michael Phelps, kind of stretching out his arms before he swims. Do something with your upper body before you swim. In a perfect world, a mix of some sort of cardio or aerobic exercise, like cycling or running or walking, along with some strength training or resistance training is really the best bet as far as, if we were gonna script it out perfectly for everyone.
Hi, my name is Toby Lees. I'm a urologist at West Michigan Urologic Associates, and I wanted to kind of focus on prostate health in general today and just touch a little bit on prostate cancer specifically and screening for it. It's the #1 solid organ malignancy in men, and so I think it's really important to talk about that and be able to at least bring it up with your provider. So prostate cancer is fairly insidious, meaning that usually we discover it through this PSA test. PSA stands for prostate-specific antigen. It's a protein that only the prostate makes. It's a very sensitive test because it's made only by the prostate. However, it's not very specific. So the PSA can be elevated when you have any abnormality in the prostate. PSA screening is an important part of men's health. It's done routinely. Oftentimes it's done in a yearly fashion through your primary care physician. It can be obtained in a setting where someone might have a urine infection or symptoms related to their lower urinary tract as well. If you were to experience symptoms related to your lower urinary tract, such as really a challenging time urinating, bone pain, weight loss that's not part of a weight loss program, those are reasons to talk to your primary care physician as well. Generally, there's ages where it's obtained. Usually less than the age of 60, it's not drawn as often. There are some reasons that it might be obtained at those lower ages, such as if you were having symptoms related to your urinary tract. So there's other things that can make your PSA rise. Those things include activity like vigorous bicycling, where the bike seat is kind of pushing on that prostate area. It can also be elevated if you have inflammation of your prostate, urine infection, but also prostate cancer can cause it. And so that's what we're really trying to make sure is not going on when we're checking this PSA test. Ways that you can decrease your chance of having prostate cancer include having a healthy diet and an exercise program. These are some of the only known modifiable risk factors that you have for preventing prostate cancer today. Additionally, if you can decrease the amount of smoking that you do, that also helps prevent prostate cancer in the high-risk form. The only other known risk factors that we know of are things like Agent Orange exposure, or if you were to be of African American ethnicity or have a family history of prostate cancer. Prostate cancer is one of the most researched areas of men's health and medicine, frankly. And so there's a number of treatment options that are available. You guys may have heard of some of these. There are common ones such as prostatectomy, which is removal of the prostate, radiation therapy, which is treating the prostate with radiation. But there's a number of more novel techniques that are being done today, and those are things that we can talk about more in the office if you come in and see us with an elevated PSA and we end up talking about screening.
I'm Dr. John Ludlow. I'm one of the urologists at Western Michigan Urological Associates. So testosterone and testosterone deficiency is one of the big topics that we see a lot of these days. But low testosterone levels can come with some significant signs and symptoms. It's relatively easy to identify and it's relatively easy to treat. I prefer to see patients in my practice and evaluate them correctly. At some of these men's health clinics, these strip mall testosterone clinics, the evaluation isn't done correctly, the follow-up isn't done appropriately, and that can lead to other problems. It's really important to have accurate testing and follow-up. In addition, some of the testosterone boosters and testosterone supplementations that are advertised online or on TV commercials, you have to be careful with those, that they're appropriate for you. I think some are okay, but it's important to understand that these boosters and these supplements aren't studied adequately. Some have no efficacy. Some need to be stored properly for their efficacy to be maintained. But testosterone boosters and testosterone supplements are really important to talk about from my standpoint and from the patient's standpoint. So going to a practice and a physician that understands testosterone, how to evaluate it, what the signs and symptoms are, how to treat it, and how to follow it is really important. Patients who have sexual dysfunction or obesity or diabetes or just general complaints of low energy level, low motivation, loss of libido, loss of muscular strength, loss of endurance, those are the signs and the symptoms of low testosterone. And those are the patients that I want to evaluate correctly. So I see a lot of patients in my practice who come in with sexual dysfunction. Virtually all of those patients I'm going to talk to about testosterone, but other patients as well. When I see somebody for benign prostatic disease who is overweight or who's a diabetic, those patients really need to be counseled regarding testosterone issues. And the benefits of this can have significant positive effects on their overall health. You know, when someone has low testosterone and is on testosterone supplementation, there's some obvious endpoints there. Good energy level, good motivation, libido, erections, those types of things. Mood elevation, muscular strength. So patients will see significant benefits. But there are potentially other benefits that you don't notice. Your bone health, your muscular health, your cognitive health, your sleep health. So there's a lot of benefits that maybe are not so obvious, but significantly beneficial.
Well, that concludes this year's Holland Hospital Men's Health event. Thank you all so much for listening. From everyone here at Holland Hospital, we wish you a wonderful rest of the year, and we can't wait to see you for next year's event.
Thank you and stay healthy.